Good evening, everyone. A warm welcome to this color therapy session. This is not color numerology. Please note, this is only color therapy. Okay. And next week, it will be numerology. See, please don't mix up all the classes. We are wantedly bringing different classes every week so that you have, variation, diversion with each class. And for today, we have color therapy. A warm welcome to each one of you. And with all your welcomes, I'm sending and with gratitude for this session for color therapy to Pooja ma'am. So let us welcome Pooja ma'am. Pooja ma'am, a warm welcome to you. Good evening. Please take over the session. Thank you.
Yes. Thank you, Anusha ma'am. Thanks. So, hello everyone. So, if you switch on your camera, it would be great because we all know color therapy is practical session. Okay. Fine. So, I hope you all are aware of first 5 elements, 5 physical elements. Yes. So today's topic is going to be super interesting. It's called metaphysical energy. So whatever we spoke in the previous class, it's based on physical energy, or what I can say physical elements. So in this session, we'll be talking more about metaphysical elements. Okay, so I hope you all are ready with open mind, open heart. Yes, everyone.
One second,
Awesome.
the chat is disabled because
Yes.
people are disturbing. After your session, the chat will be reopened and all the queries. And for queries, please raise your hands and switch on your videos. Okay? Yes, please. Please continue. Thank you.
Yes.
And your
Yes.
network is very low. So please take care or shift to a different place.
Oh, is it? Okay. Yes. Once again.
Yeah.
Yes. Okay. So we'll begin.
Yes.
So can you show me your finger numbers, everyone? I hope nobody have forgot. It's okay if you have forgot also. So we'll be revising. So this is my right hand. So where I'm wearing black bracelet. So this is my right hand. This is my left hand. Okay. So so just keep your hands like this, everyone. So this is number 1, finger number 1. Okay. Finger number 2, left little finger. Finger number 3, left index. Finger number 4, right index. Finger number 5, right ring finger. Finger number 6, left ring finger. Finger number 7, left middle finger, left middle finger. Finger number 8, right middle finger. Finger number 9, and finger number 0. So it's not called 10, it's 0. So 0 can be before 1 also and after 9 also. Okay, so we'll begin the session. So I hope you all are ready. Okay, so we all know where is finger number 6. Finger number 6. So this is your left ring finger. Okay, finger number 6 represents Kal. Okay, so what are the 10 elements? So we'll just revise few things. Akash, Vayu, Agni, Jal, Prithvi, Kal, Disha, Man, Atma, Tam. So these are 10 elements. So we have covered Akash, Vayu, Agni, Jal, Prithvi in the previous session. So now we'll be starting with Kal element. Kal, Disha, Man, Atma, Tam. Okay. So what is Kal? So the spelling is K-double-A-L. K-double-A-L. Okay. So what is Kal? Kal means time energy. So I want you all to write it. Kal means time energy. Okay. So when I say time energy, what comes to your mind? How many of you thought about this? How many of you actually thought this? Yes, everyone thought, okay, time means clock. Okay, or wristwatch. Okay, so this was the one thing. Okay. So you have one sentence, Kalaya Tasmai Namaha. So time is one of the most powerful tool. Okay, within 1 second anything can happen. You could just lose your life. If you're standing somewhere in main road, And if you just put your earphones on, and if you just miss, within 1 second, you can save your life, within 1 second. Okay, how many of you have very good time management, and how many of you don't have good time management? Yes, how many? Okay, if no, you can do this. If yes, you can do this. Okay, fine, fine, fine. So when we talk about time energy, so there's so many things. So time energy is related to our nervous system, nerves in the body, spine, okay, and our day-to-day activities. So as soon as you wake up, you all are hungry. Okay, after some time you'll have lunch, and then you'll have dinner. So this is called time energy. Okay, so the time of puberty. Okay, so for marriage also there is time period. Nobody is going to get married by 10 years, 5 years. Okay, so there's time energy, so time period for everything. Okay, so many people have white hair, gray hair, so many youngsters are also having because of the radiation. But back then it was only for 40 plus people. Okay, so they tell, okay, I'm growing old. Okay, so everything has time energy. Okay, so now your spine is related to sixth element. I'll give you an example. Nobody should have this confusion. So why is she saying this? Why is she relating this to this element? Okay, now why spine is related to sixth element? Okay, I'll give you one example. So how many of you had this monkey to man chapter? In history, we all had this, right? Monkey to man, early man stage and everything. So if you have seen the spine of early man, it was curved, it was not erect. Okay, so how many of you agree? It was bent, it was something like this. Okay, but as human evolution started happening, so the spine also became erect, and our, what do we call it, as our intellectual capacity, our memory is great. So you can see younger generation kids, they know how to use phone and all. Okay, but back then we didn't know how to use phone, like when we were 2 years, 3 years and all. Okay, so this is what we call generation gap. Okay, and also any spine related issue, so I'm giving one protocol, please make note of this. So this is according to the third level, fifth level, I'm giving advanced protocol. Okay, so we have so many things in further classes. So we have vertical meridian, horizontal meridian, spiral meridian, etc. Okay, so those who have any spine related issue, top to bottom, okay, make sure you're using finger number 6. Okay, so what you have to do is just take fenugreek seed and just put it on all three joints, if you have chronic backache. Okay, but if you have it from very long time, if it's too chronic, how many of you are actually suffering from backache, like from 12 years, 15 years, 20? Oh my god. Okay, there are many people. Okay, so what you can do is from top to bottom. Okay, not only on the joints, on the phalange also, make sure you take surgical tape, put fenugreek seeds completely and cover this area completely, top to bottom, your ring finger. Make sure you cover it and see how you feel. Okay, and this is one task. So those who have task also, we have something special bonus. So Anusha ma'am and sir will let you all know later, but I want you all to try this and experience. Please don't attend this class just for making notes and all. Just try to make it, you know uh, try to impact. So it should impact on your body, mental level, emotional level, physical level, everything. Okay, yeah, so this is for spine related issue. And also Carl is related to nerves. Okay, So when I say nervous system, what comes to your mind? It's not only spine. Okay, it talks about your brain as well. Now, what happens if the person has fever, let's say 100 and more than 102 degrees? What happens? And if it's uncontrollable, it will affect your brain. If it affects your brain, the person might have paralytic attack, strokes. Okay, how many of you have seen this live event? I mean, live thing happening. Okay, because just because of fever, so many things. Okay, Mercy ji, have raised your hand. Okay, so many things can happen. Okay, when the body temperature goes up. Okay, so please make note of the color. So to tonify Kal element, we use orange color. To sedate Kal element, we use red color. Okay, and don't forget the first sentence what I told you, Kalaye Tasmai Namaha. Okay, time is very precious and make the most out of it. Okay, so when you waste your time, all your planets will also be very malefic, and that's how you'll have every doshas. But many people tell, do this puja, that puja, give me 20,000, 30,000. It's not going to work until you respect time. So if you respect time, time will respect you back. Okay, so that's the thing. And how do we use color? Okay, so when to tonify, we'll be learning this in class because I don't want to give half knowledge. And somebody will try this and they'll give some other feedback itself. Okay, so so I'll tell you when to tonify the sessions. So when we have this long sessions, when to sedate Kal element. So number 6 talks about nerves, right? How many of you have nerve related issue? It can be sciatica pain. It can be related to mouth sensation. Yes. Okay. Okay. So many of them have. Okay. Now what you can do is, so can you tell me the sedation color? Red. Okay, so whenever you have pain in the body, so pain can be due to many reasons. Okay, so those are professional therapists, they ask so many questions. So it's like, if I have leg pain, or just try this protocol. So that's not how you give treatment. So you need to ask question why you're having this issue. Now let's say you have knee pain itself, knee pain or calf muscle pain. Okay, pain can be due to various reasons. It can be due to external wind. Last time we spoke about the elements, if you all remember, Vayu, wind energy. Okay, sometimes it can be due to stiffness, hardness, Prithvi element. Okay, now those who have nerve related issue. So when you have nerve related issue, what are the symptoms and how do you know this is related to nerve? How do you analyze? You get that shocking kind of pain, a pulling sensation. Okay, so this is when you understand the pain is related to nerve. So what you can do is use red color. Use red color. How to use? So we'll be talking about this, but I'll give you one protocol. There's so many things when you have pain in this location, this location. So some changes are there. But those who have backache plus nerve related issues. So can you all make note of this? Backache plus nerve related issue. When the nerves are compressed, whenever you have slip disc, any spine related issue, make sure you are sedating number 6. How many of you remember the spine correspondence? How many of you know how to draw spine correspondence? Amazing. Wow, amazing. Nice. Yeah. So starting from your nail plate, I mean below the nail plate, starting from here to your knuckle joint, just draw one straight line. Just draw one straight line. Okay, so if you want me to show, I'll just show 1 second. Yeah, so I hope you all are ready with red sketch pen. Yes. So starting from your left ring finger only. Okay. So this is how you are supposed to draw red color. So make sure the line is straight. And if possible, you can make it little thick also. Okay, so I'll just draw it again. I'll just draw it little thick. So make sure you extend like this. Okay, so this will give fantastic result. Okay, so this is for backache. Backache plus nerve related issue. Now let's say you have backache, but the root cause is something else. Okay, for example, Kantaji might have backache due to nerve issues. Is it, Kantaji? Do you have it because of nerve issue? No? Okay, so quickly unmute and just say what's. Yes.
No, I don't have back pain, but I have nerves weakness because of diabetes.
Oh,
So
okay.
all
Then
nerves
this.
are paining, legs nerves are paining.
Okay. This is the different issue. Okay. Fine. Now let's say if the person has backache, lot of backache issue, and those who have nerve related issues. So this is the protocol. So you just have to draw one straight line. Okay. Again, backache can be due to many reasons. It can be due to degeneration. Okay, for degeneration we have different color, but trust me, this is the best protocol. Like 50% of your problem will be sorted if you draw this. Okay, and also we have in color therapy we have so many categories. So whatever we are talking, today's session, last time session, it's called Ayurvedic acupressure. So Ayurvedic acupressure, Patanjali yogic system of chakra, German concept, and TCM. So there are 4 categories in color therapy. Okay. So I would just like to add on one more concept. So that is, the German concept. So according to German concept, those who have nerve related issue, those who have chronic issues, so can you see their hands keep trembling like this? So they can't hold a glass of water. So how many of you have this issue? Shivering hands or legs or anything. Major issue. Sciatica pain. Those who have sciatica pain or anything, what you can do is just take red color. Okay. This is according to a German concept. I just want to add on one concept because this protocol can just save so many people's life. Okay. So how many of you are ready? This is out of box. Okay. So just take red color. Okay. Make sure you put it on left index finger. Left index finger. So can you all keep your hand like this, everyone? So let's do it together. Okay. So just keep your hand like this. Fine. Now make sure you shade this area. So whenever you close your eyes, so can you see I put red color, but it's not visible. Can you see? It's not visible. So this is how you're supposed to draw. Make sure it's in the border. Okay. So you just have to put red color. Make sure you extend till this joint. So how many of you can feel the meeting point of these two joints? I mean these two bones. So make sure you shade it till here. Can you see it's not visible at all? Yes, is it visible? So this is how you're supposed to draw. This is the best protocol. Yes? Okay, awesome. Now send me the pictures later. Send me the pictures on the group. Okay, awesome. Yeah, most of you have done well. Okay. So this is the protocol for sciatica pain. So this is sedation color. Okay, so this is on number 6 and we have so many things. Okay, and let me give you one more protocol. How many of you have tooth sensitivity? Tooth sensitivity? Yes. Okay. So can you all show me your mouth correspondence? Yes. Mouth correspondence. Bye. No, can you show it on finger number 6, mouth correspondence? 6. Yeah, okay. So this is the location. So this is the location. So make sure you shade this area completely with red color. Okay, so make sure you shade this color here. Okay, so when we say mouth, it's not only this part, it's not only this much, it's still here. So wherever your wisdom tooth is. Okay, so we are going to shade this area completely with red color. Okay, so this is on Kal element. Okay, and then one more protocol. This can really save someone's life. There are so many students who have given fantastic feedback on this, and that's the reason I'm giving this protocol. So when the fever reaches, up to 102 degree also, sometimes it's dangerous, and we all know it. So what you can do is to reduce the body temperature or to reduce sensitivity, you can apply red color on yang brain. Finger number 6, yang brain. So make sure you shade this area with red color. Okay, so you can see instant result. Okay, so this is on number 6. Okay, finger number 6. Understood? So everyone clear with finger number 6? So Kal is not just clock. It's beyond philosophy. Okay, so that's the thing. And then, so next one is direction. So when to tonify, we'll be doing this in class. I don't want to give half knowledge in any of my sessions. So we do it in the paid sessions. Now finger number 7. Finger number 7 is left middle finger. Left middle finger. Okay. So the tonification color of direction, disha, is red. Sedation color is pink. Tonification is red, sedation is pink. Okay, so whenever I say disha element, direction, what comes to your mind? Disha. Okay, what is it? Direction also talks direction of your mind. Okay, so in nature we have direction. Okay, so plant will grow in certain directions. If you see the size and shape of banyan tree, it grows in different direction. Coconut tree grows in certain direction. Okay, wind blows in certain direction, water flows in certain direction. So everything has particular direction. Okay, so one day a person can become like Ram or Ravan. Okay, person can become like Barack Obama or Osama bin Laden. You can become a good person or like a terrorist. Everything is based on a mindset, direction of mind. Okay, so your mind is cause for everything. If you're happy, you are the reason. If you're sad, you are the reason. Okay, externally, anyone can try to manipulate you. They can just try to, put you down. But the way you react to things, that matters a lot. Okay, if someone says, oh, you look like a donkey, do you even believe it? Do you actually look like that? No. Okay, but if the direction of mind is deficient, or if your mind is weak, you might be like, oh, maybe I'm not good looking, so you'll have this kind of perspective. So you need to have strong mind and strong direction. Okay, so now how to use this color? Please make note of this: when to tonify, when to sedate. So finger number 7. So when you fall in love with someone, so you have seen in movies, cartoon, animation and everything. So nobody is going to give purple color flower and say, I love you. Nobody is going to give yellow color, white color. Why is it red color only? Why not some other color? Why? Red. Red color is direction. The direction of your mind changes. It's about taking action. Red is all about action. Okay. And if you see any posters like this person is killed, murder case, or whatever, again it's in red color. Why? Excess of this element can lead you to a negative mindset or negative things. Okay, so have you seen the posters? So whenever you see anything, she is murdered in newspaper or whatever it is, it's not in blue color, yellow color, green color. Have you observed, everyone? Just nod your head, yes or no. It's never going to be in yellow color. Yellow talks about being very happy, joyful and all. Why red color only? So this is the thing, so if it's excess, if this element is excess in a body, this can lead to bad habits, negative things. Okay, so whenever the mind is going in a wrong direction, please make note of this. Whenever a mind is going in a wrong direction, stress is also one cause. Okay, actually you need not take stress at all. We come here for some reason, we get so attached to this materialistic world and we get so indulged in this. But our soul level, our soul has come here for some reason. Not everyone will realize until we all become old. Agree? Yes or no? Okay, so once you're done with your kids' marriage and everything, then you start thinking, okay, what's the purpose of my life? Okay, so okay, so I'll tell you when to set it, when to tonify this element. Make note of this. When you think there's no purpose in life, or when you see lack of direction, so when you have lack of direction, I just don't know what to do in my life, I have no purpose, why am I alive, so when you have these kind of thoughts, okay, or you want to do something but you're not getting that proper direction, you want to become artist, singer or whatever it is, but nobody is there to guide me. So when you don't have that direction, and please make note of this, it's a single point treatment. With this, don't combine any other protocol. Okay, strict warning. So this is single point treatment. So use red color on left middle finger. So I'll just draw it and show you. Yeah, so this is how you are supposed to apply red color. Okay, but those who are have lot of bad habits, or like those are lacking in whatever it is, like bad habits, smoking, alcohol, stress and all, for them it's not useful. Okay, only if you feel you want some direction, purpose in life, then you can try this one. Okay, you won't believe it, the way the kind of feedback I've got from all the students. So many people, their work will be stuck for so many things. You have to get so much money and somehow it's not happening. You want to apply for this job, it's not happening. So this have given direction. This is the best protocol. Okay, so just try this and keep me updated. Okay, but now when do we have to set it? When do we have to set it? This element. When do you have to sedate this element? So what are the negative emotions? Negative emotions, when you have depression, any mind disorder. So, as we learn further, we tend to forget basic things. After learning ABCD, how to write paragraphs and all, later you might forget after M, what's the next alphabet? LMN. Okay, something like this. So in color therapy also, as we move forward, you might tend to forget the basic. So please make note of this. So whenever you have insomnia, stressful life, how many of you have insomnia? Hi. Okay, Rekha ji. Yes. Okay. So those who have stressful life, those who are addicted to smoking, alcohol, tobacco, drugs, okay, and those who have anger issue, lot of mood swings, okay, so any negative emotions that comes to your mind, okay, so to sedate this, so I've already told you, so when the disha element is excess, it's dangerous, murdering, killing. Nobody is going to become terrorist in one day, okay, so the kind of things, so many things can impact their mind, and that can lead to bad direction or good direction, whatever it is. You can become a divine soul or whatever, bad person. So everything starts from here. Okay, mind is very powerful too. Okay, so no, so this is how you use it. So this is disha element. Finger number 7, sedation. Sedation. So those who have insomnia, stressful life, mood swings, if you feel like crying for no reason, and also those who have suicidal thoughts, those who feel like committing suicide, whatever it is. So whenever you have a bad day, make sure you use pink color on finger number 7, and see the kind of impact is it's there in your mind. So the way you see life will be in a different perspective. Okay, so this is on disha element. Okay, so done. And then there's so many things about disha element. Finger number 7. So example, there's so many examples. Direction, misalignment of spine. Okay, so we all have curvature. So we have spine, right? So each bone is called curvature. The medical term, it's called curvature. So when there is gap between two curvature, it's called slip disc. Or if it's too nearby, it's called compression. So we have so many terms. Okay, so whenever you have any spine related issue, backache, how many of you have problem when you're bending forward or backward? Oh, okay. Yes. So here what you need is proper direction. You're not going to sedate here. So what you need is proper direction. So you're going to tonify number 7. So we all know where is spinal cord. Finger number 7, spinal cord. So here also you are going to apply red color. So make sure the line is straight and make sure you extend till your knuckle. Those who have backache, please try this. Red color on both, like middle finger and ring finger. Only left hand. Yes, Anuradha ji have tried this. Okay, that's awesome. Very nice. Okay. Yes. Fine. And then, so this is on disha element. Okay, so how many of you are finding it interesting? With all the example, how many of you are enjoying the session? Yes? Okay, awesome. So this is on disha, and then we have something known as man element. Finger number 8, man. Finger number 8, man. Man means mind. Mind. Just 1 minute. Powerful. Okay. Finger number 8 is man. Mind is powerful. Okay. So once you know how to control your mind, when you understand many things about mind, you can just navigate anything in life. Okay. So the process of manifestation also becomes faster. Okay. So many people who have spent lakhs of money, like I'm giving my students feedback. They spend lack of money just to manifest things, and they don't teach the right things or right kind of manifestation techniques. Okay, so when you have a lot of blockages, emotional blockages, how can you manifest? Okay, so when you have so many negative things, okay, how can you attract abundance? Okay, so this is one thing. So right middle finger is man. So the tonification color is pink. Sedation color is, I don't want to say this, but it's purple. We don't use purple color. It's been 10 years of experience in this field, color therapy, acupressure. I or my students have tried sedation. So make sure you don't use purple color, but just for your information, I'm giving this. Okay, so the tonification color of man is pink color. We always use pink color on finger number 8. Okay, mind is such a powerful tool. So can you see mind? So when I say mind, it's not brain. So brain is different, head is different, skull is different. Mind is again metaphysical energy. So today's topic itself is metaphysical energy. Okay. So whenever you have mind related issues, so can you give me the examples of mind related issues? Depression, anxiety, stress. Everyone has stress, like 99%, or let's say 95%. Many people have stress, anxiety issues. Okay, and then low self-esteem, low confidence. So when you don't feel confident, everything is your mind scape. Your mind is playing a game. Okay, how many of you just feel like crying for no reason? Sometimes you cry alone and you don't know why you're crying. Why does this happen? Sometimes this happen. Okay, mind is very powerful tool. Okay, so you can think you're a winner, you are world's best person or world's worst person, whatever it is. So this is all your mind playing a game. Okay, so whenever you apply pink color on right middle finger, you see life in a very different perspective, in a very positive way. Okay, so whenever you have a bad day, or if you have too much of emotional blockages, you can apply pink color over here and see the kind of result you get. Okay, so as soon as you wake up, you feel energetic. Okay, there are people who sleep, but as soon as you wake up, you're like, just for the sake of waking up, you wake up. Okay, you don't feel that energy, you don't feel that enthusiasm anymore. Okay, that's when you have too much of emotional disturbance. Okay, or to even accept death of your loved ones or whatever it is. So this will give you emotional strength as well. Okay, emotional strength, and also mentally, this will give you a lot of power, I can say. Okay, so this is on number 8. How many of you are counselors here? Psychologists, counselors, psychiatrist? Okay, a therapist? Anyone? You would have, yes, okay. So you would have dealt with so many people who don't open up. Okay, so what's the issue? They don't tell, they don't talk at all. Okay, so you can give 2 hours of lecture, 5 hours of lecture, 10 hours of lecture. Okay, but something from their mind or something from their soul, should change. Okay, so you can be like, it's okay, don't cry, be happy, but it's up to them how they see life in a different perspective. Okay, so convincing others is difficult no matter what. So you will say life is beautiful, just look at this tree, this is amazing and all. They'll see a tree and they're like, what's there, what's a big deal? Okay, so the way you see life is different. How others see, it's completely different. Okay, so why I'm giving this example, when the person feels very low, when they don't feel like opening much, okay, or when they feel like even if I say what's the use, so when I have these kind of thoughts, you can definitely change someone's mood. So everything from internally changes just by applying pink color, and that's why I'm giving you so many examples. Okay, yes, Kantaji, what is this?
ये पिंक कलर पूरा लाइन लगाना है.
No, it's only on the young brain.
Okay, thank you.
Yes.
Ma'am,
Okay.
we can start queries now so that everyone will be covered now.
Yes, sir. Yes, Sanusha ma'am.
Yeah.
Yes, and any questions? Sushma ji, I've done it perfectly. Sushma ji, can you just unmute yourself? 1 second. Yes, Sushma ji, you can unmute. Hello, Sushma ji. Yes.
Namaskar, ma'am.
Namaste.
Ma'am, when you were telling about Disha,
Yeah.
when you said that if you have difficulty in bending forward and backward, I could not just cope up with what you were saying. I was left behind. So can you repeat that?
Okay, yeah, definitely. So whenever you have spine related issue can also be due to misalignment of each curvature. Okay, so so whenever your hand is twisted or whatever it is, this is different. But when there's disturbance in curvature, too close or too far away, so what you need is proper direction. So what you have to do is tonify direction element, because you need that direction, proper direction. So we always tonify when there is any spine related issue. Most of the time it's tonification, Sushma ji. Yes, I hope I answered your question, Sushma ji.
I request everyone to raise your hands and switch on your video.
Yes,
नमस्कार
Shivani
मैम.
ji. Yes, Shivani ji. Hello, namaste.
मैम आपने कहा आगे बैंड करने या बैक बैंड होने पर स्पाइन में इशू, बट मुझे स्पाइन में इशू नहीं है. देयर इज क्रैकल साउंड इन माय नीज during the time of exercise. And nowadays there is some stiffness and pain also in my knees.
Okay. Definitely. So what you can do is you can apply. So we all know where is the knee correspondence. Can you all show knee correspondence? It's on your middle finger. Can you show the location? It's on the middle joint. Okay. So Shivani ji, what you have to do is take red color, same color. Okay. And make sure you apply it on the joint. Okay. So completely. So can you see this?
Yes ma'am.
Yeah. So just try this, Shivani ji.
Okay ma'am.
Yes.
There is no issue of space at all ma'am. Means space की कमी होने से joint में crackle sound.
Yes. This is related to which element? Space. Yeah. Which element? Number? How many of you remember?
1.
Yes. Excellent. Okay.
Ma'am.
Finger number 1, tonification. What you need is space. You need flexibility. Okay. So what you can do is take purple color and apply it on right little finger, middle joint. Same thing, just like this on right little finger.
Okay.
Shivani ji, I hope I answered your question.
Yes, ma'am.
Yes.
Thank you.
Yes, welcome. Yes, and next question. Anusha ma'am, you can unmute anyone. Okay, Mangal, sir. Hello.
Yes. Hi, madam.
Hello.
Can you hear me?
Namaste. Good evening.
Hello. Namaste. Good evening.
Namaste. Yes.
Madam, the one thing you said about the element to put to tonification of 6 number finger tonification color.
It's orange color.
Orange and red, na? Orange
Yeah,
and red.
sedation is red. Sedation is red.
Sedation.
Yes.
Okay.
Yes, Mangal.
Okay. Madam, one question is out of this syllabus. Can I talk with you personally? Can I call you?
Yeah, sure. You
Because
can
it is
text me on WhatsApp. Yes.
because it is a small baby is there, and that Edwards syndrome is there.
Oh, okay.
Edwards
No, we'll talk in person, Mangalji.
person. I'll call.
Yes.
I'll message you. Then I'll call you. Okay.
Yeah, sure. Yes. Then, yes, Anusha ji, you can unmute. Nima. Yes, Sonal ji. Hello.
Hello, Pooja ji.
Hello.
We did number 7 and number 8. Now, in number 7, you said for any mind disorders, insomnia, or addictions, or whatever, you
Yes.
put left hand ring finger pink dot under the yang brain,
Pink color.
on yang brain.
Yes.
But also in MAN, we just now said if we have insomnia or depression
Yes.
or low confidence or whatever, again we said pink color on the middle finger under nail. So we have pink
Yes.
color on both the fingers, 7 and
Yes.
8.
Yes, both simultaneously.
Oh, I see. Okay.
Yes.
Both young brain pink color.
Pink color. Yes.
Okay. And for sedation of MAN, you said not to you. It's supposed to be not violet, not purple. You said.
Yes. We are never going to sedate number 8. Never. So.
Okay. So.
Yes. So anyway, the sedation color is purple, but we are never going to use this. Only in chronic cases, like only experts can try this along with the other symptoms, but but a big no for sedation.
Okay. All right.
Yes.
Thank you.
Yes, welcome. Hello, Lakshmi ji, how are you? Yes, Lakshmi ji, please let me know your question.
Ma'am, I am having thigh pain. Because of that, I am not able to sit normal position.
Okay.
Whether it is nerve related?
Okay, you can talk to me personally because diagnosing is important. So yeah, so you can ask
I
questions.
applied red color. I applied red color just now.
Okay.
Little bit better.
It's better. Okay. Yes, you can try your number 7 and 6 also, Lakshmi ji.
Okay, ma'am.
Yes. So can you all see the the pain is in thigh region. So whenever you have pain in thigh region, so again thigh can be it can be related to nerves. Who knows? Okay. So what you can do is apply red color on either side. Okay. So something like this. So shade this area completely on the thigh region. So this is how you can try, Lakshmi ji. And next question, Ekta ji.
हेलो मैम।
हेलो।
डायरेक्शन में ना मुझे कंफ्यूजन हो रहा है क्योंकि मेरा दोनों में वो हो रहा है, तो रेड में भी हो रहा है और पिंक में भी हो रहा है, तो क्या करने का उसमें?
Okay, do you have like any chronic addiction or something?
पैरालिसिस है मेरे को, पैरालिसिस।
Okay. So no, I'll talk to you in person. You need to combine other colors as well. So don't try any single one.
ओके, ठीक है।
Yes.
थैंक।
Yes, welcome. Yes, Smita ji.
Hello, yeah, ma'am. One place you told ki you have to put red color when you have pain or something here.
Not pain, no. That is Disha element. Not for pain.
Okay, that is Disha element. If you want direction or something like.
Yes.
You're not. And then suppose if you are having stress, all those things, then can we put here pink and here red?
No. You're not supposed to combine 7 tone, 7 tone and 8 tone. Don't try these two combination.
Okay.
Yes.
So we have to either put red separately and then separately pink.
Separately, I will be talking how to combine 7 and 8. But yeah, so if you're lacking in direction, first thing you need to do is apply red color, like for 3-4 days and just leave it.
Okay,
Yes.
and then we can apply pink color for
Later on. Yes,
later.
yes. Definitely. Yes.
Okay, thank you, ma'am.
Yes, welcome. Hello, Sangeeta ji.
हेलो पूजा मैम,
Hello, hello.
वांट टू नो कि वात और पित्त, वात को बैलेंस करने के लिए, वात इज बेसिकली द आकाश एंड द वायु, आकाश एंड वायु, तो वात को बैलेंस करने के लिए क्या कर सकते हैं?
Okay, no, so we have, it's a huge concept. So we can't combine this in color therapy, but yeah, we'll have this in further sessions.
Okay.
Yes.
Thank you.
Yes, welcome. Rajeshwari ji. Rajeshwari ji, you're on mute.
Please unmute yourself, ma'am. Rajeshwari ma'am,
You're still on mute.
you're not unmuting yourself.
No, you're not audible.
Okay, I'm going to another person.
Yes.
Shilpa Hiten Soni, please switch on your videos if you want to ask queries.
Yes.
Hello, ma'am.
Yeah, hello, Shilpa ji.
Ma'am, on the left side of my upper lip, I am having a little swelling over here.
Okay, and what's the root cause?
So, ma'am, that is not actually diagnosed because there is no burning, no itching, and no sting of any insect or anything. It just came suddenly, and it is there from 3 months.
3 months. Oh.
Yeah.
Oh, okay. I need to talk to you in person. Just like that I can't give. But anyway, swelling can be due to excess of water element. And your face looks like liver type. So we have so many types of body constitution: wood type, earth type. So I think liver is more deficient in your case, is what I feel. So yeah, that's the thing.
One more thing I'm having with it is dry piles. So is this both anyway related?
Dry piles. Okay.
Yes, ma'am.
Okay. So I'll give you one simple remedy. So what you can do is just take surgical tape, half-inch tape. You can just put surgical tape. So start from here and then paste it till here. So just keep your finger like this. So start from here and till, you can extend till here on both the hands, left and right. Yes. I hope I answered your question, Shilpa ji. Yes. Marcy ji.
Good evening, ma'am.
Yeah, good evening, Marcy ji.
Nice color therapy.
Thank you.
Ma'am, last 2 years I'm having itching between two groins. And one more question. Past week, during only sleep, not walking, not sitting, not squatting all the legs, nothing, I'm having pain. Only during sleep, I'm having left knee pain and pulling the calf muscles.
Okay.
Only the night. Only sleep. Only during sleep.
Okay. Okay. For this, I'll suggest magnets. So those are not TCM, it's liver 3 UB54 sedation. Just try this, Mercy. If you don't know, like you can just ping me privately. So again, this is due to kidney and liver deficiency. Yes. Okay. And then Dr. Chandrakalaji. Yes, you can unmute Chandrakalaji.
Hello.
Hello. Yes.
Hello, Madam. Namaste. This is
Namaste.
This is the first time I'm attending, ma'am. I'm from Mysore.
That's
very
okay,
excited to see you.
Yeah. Thank you.
But previously, I have done many therapy classes. I have severe back pain, ma'am. Then pain L4-5, and radiating to still little right side, ma'am, right up to the hip.
No. Radiating up to what? I lost
Pain,
you.
ma'am. Severe back pain.
Okay. Radiating till?
Severe back pain. Radiating up to the hip, hip joint. The L4-5 pain. There I had little on taking therapy, ma'am, in some therapy class. So L4-5 point I had injury. Then the pain while doing walking radiates.
Okay, fine. Yes. So I'll give one protocol.
Back pain also I have.
Okay, back pain also. Yes. Now everyone, please make note of one protocol. Okay, this is again not part of color therapy. So in color therapy, we have set of protocols. It's not only red, only purple. So we have set of protocol. We'll be discussing that in further sessions. Now, those who have specific pain, I'm talking about specific pain. So pain in lumbar region. So we have categories of you all know: cervical, thoracic, lumbar, sacral, coccyx region. Okay, so when you have pain in L4 and L5, being very specific, L4 and L5, make sure you all put methi seed on both index finger, upper joint, both left and right hand, index finger, upper joint, and then both thumb, upper joint. Okay, so if you want to understand the logic, attend all the sessions, you'll come to know. But this is fantastic treatment. And also, when the person has spine related issue, starting from C1, C2 to coccyx area, just take mutter seed, the one we use for pani puri, dry mutter seed, put it in surgical tape and just put it on your only right wrist joint, just like a bracelet. Paste it over here and see, you'll see a lot of changes. Yes, Chandakaji. I hope I answered your question. Yes, and next, Yasmin ji.
Good evening, ma'am.
Good evening.
Your class is amazing. And I would never like to miss, but sorry, I joined in late because I had guests. So now my thing is, I have a femur fracture. Femur bone fracture. Femur bone fractured above my knee.
Oh.
And it has been 3 months now.
Okay.
But the calcification is slow. So I have been given the Jamfrec injections for 1 month, and this is the second month I'm continuing with that injection because after 1 month the calcification started. So the doctor said you take 1 more month and that will help you. My operation is done. They have put a plate with 10 screws, titanium plate.
Oh, okay.
And I'm still not allowed to put my right foot on the floor because no weight bearing. So anything that would help me. Right femur bone is fractured just above the knee. It is diagonally fractured.
Diagonally fractured. Okay.
That knee joint is not damaged.
Okay.
But the bone above the knee joint has fractured.
Okay. Now for this you should have different magnets. It's called cluster magnet. So I'm going to share all the links on group. Please everyone buy it. You never know when you might need it. So it's called cluster magnet. So
I got cluster magnet.
You have it? Okay.
Yes.
So what you have to do is just put cluster magnet on the location. So I think not everyone are aware of mega meridians. I'll just mark it on my wrist joint and send the picture. So Yasmin ji, try this and let me know. I'll mark it and send. Because if I tell now in the class, everyone will get confused.
Okay. So both the hands you have to put or only one wrist?
You can try it on right hand only.
Acha, my right femur is there, so right means you mean.
Sorry, it's on your left hand. I'll just post it.
My fracture is on the right knee, right femur. Huh?
Right. Yeah. No. You have to do it on your left hand. I'll send a picture.
Okay. And one more thing, feedback I would like to give you. You had asked to apply orange color on the first joint of the little finger, both the hands for constipation.
Yes.
Which I tried and I've got very good results.
Oh, that's amazing. Very nice. Very nice. Awesome. Thanks for sharing your feedback. Yes. Punita ji. Hello.
Namaste, ma'am. Thank you for the detailed session, ma'am.
Yeah, thank you.
Ma'am, I have a UTI problem, ma'am. Now and then I get UTI problem. Doctor Gynec tells that it's because of your prolapsed bladder.
Prolapsed bladder. Okay.
Yeah, and many MS now quite frequent I get UTI problem, ma'am.
Oh,
So
okay.
every time I have to take antibiotics, ma'am.
Yes. Okay. So as a therapist, I will never, ever say stop taking medicine, try only colors. I'm never going to say this. So if you're taking medication, you can simultaneously try whatever it is, acupressure, color therapy, numerology remedies. Okay. For UTI, you just have to apply black color in between these two fingers. Here exactly.
Okay.
Punitaji, every day on both left and right hand.
Every day, ma'am?
Every day, yes. If you just put it for 6 to 8 hours, it's more than enough. Just before going to bed, try this. As soon as you wake up, you can wash your hands.
Night time, can I put color therapy, ma'am?
Yeah, definitely, yes.
Okay, okay. Thank you, ma'am.
Yes, welcome. Yes. Balakrishnan, sir. Hello, sir.
Good evening.
Good evening, sir.
I want to know the degeneration color, spine degeneration.
Spine degeneration. Okay. Sir, we'll be having this in the next session, sir.
Next session.
Yes,
Okay.
yes. So that's many elements like 4, 5, 3, 6 and all of that.
Okay.
So yes, sir. But for spine related issue, you can try this, sir. Mutton seed on right wrist joint, sir.
Right wrist.
Yes,
Okay.
yes, sir.
Thank you.
Yes, welcome. Yes, sir. Rajeshwari ji, are you able to mute now?
Yes, madam. Akka,
Okay, awesome.
good evening, madam.
Good
Thank
evening.
you for the session, madam.
Yes.
You told that for the lumbar pain and back pain, you told that number 6, you have to use that red color.
Yes.
That pain is radiating up to buttocks, madam. That spinal cord, lumbar canal stenosis, that radiating pain is
Okay.
L5, L6 to up to buttocks. Shall I continue? This treatment is enough, madam?
Okay, so I wouldn't say this is enough, but what you can do is that there's so many things, like finding root cause is very important. For example, if you had a fall, because of the fall,
Yes.
which
Yes, due to fall only, madam.
Due
What
to
you are
fall.
telling. Yes.
Okay. I think one more person, I think Chandrakala ji, remember the name. Chandrakala ji also had the same issue, I guess, the
Yes.
lumbar pain,
Due
and
to
also,
fall,
yes.
I am not able to use this third finger, madam, in the right hand. So
Oh.
when I was falling that,
Okay.
I am not able to use this. So I have given support to this finger. So not able to lift the finger and all that. It has
Oh.
the
Oh, okay.
2 to 3 times I had a fall, madam.
Fall. Okay. Yes.
Yes, sir.
Yes. So when the person has lumbar pain, basically, and many women might have pain in the pelvic bone. Okay, pelvic bone. So what you can do is I'm giving advanced protocol. Okay, on your both ring toe, not ring finger, ring toe. It's on your feet. Okay, so that is next to your small toe, smallest toe. So next to that, so that is called ring toe. So if this is my ring toe, so make sure you put methi seed completely. So cover the nail portion completely. Just try this. Those who have lumbar pain or pain in the pelvic region, if the pain is radiating till wherever, the ankle region, your knee joint, till anywhere, okay, so the pain will be gone. Chandrakalaji, I want you also to try this. Yes, so yeah. Yes, Rajeshwari, even you can try this. Okay, so yeah, so last 2 questions. Yes, who would like to answer? Ansuya ji. Ansuya ji, you're on mute. Can you unmute?
Ma'am, we are
Ansuya ji?
unable to hear you. Please unmute yourself.
Ansuya ji, unmute.
Yes.
Yes.
Good evening, ma'am.
Good
Your
evening.
sessions are always, but due to some issues, So
Okay.
I'm not able to attend. But
Okay.
today's session was superb. I
Yeah.
wanted to ask one question.
Yes.
Doctor told me to do angiography, but
Okay.
I'm avoiding. So for that, which color I have to apply?
No. What's the issue?
Sometimes this when I climb stairs, no,
Okay.
I do can't breathe. Short breath I have.
Shortness of breath. Okay.
Shortness of breath, and sometimes it goes very nicely. And I did a 2D echo also. So for after checking that, doctor told you do angiography, then we will go. But I don't want to go to hospital. It is better to do. Better to do he.
Okay. Fine. So this is called H7. Okay, so everyone on both
Okay.
left and right hand. Okay, so make sure you put one dot with red
Okay.
color and see Aji. So your heart
Okay.
palpitations will reduce. So again, heart palpitations can be due to many reasons. It's not always due to heart. Okay, so when you have chronic heart palpitation, it's related to heart. But again, there's so many things. It can be due to vitamin D deficiency, iron deficiency, or spleen deficiency. There's so many things. Okay, but this is protocol in general, Ansuyaji. And I think you have a lot of emotional disturbance, Ansuyaji. I can just see that in your face. Okay. Yes, just try this, Ansuyaji. So it'll make you happy as well. Yeah. Ansuyaji, you're on mute.
For emotional disturbance, which pink color on middle finger, right young brain.
Right.
Emotional.
Yes.
Yes.
Both. Finger number
Both middle
7
finger.
and 8.
And number 7 and 8.
For
Yes.
that,
Pink.
7 and 8, pink color.
Yes.
Yes.
Right tonification and left sedation.
Sedation. Yes. Okay, so last one question. Have another meeting. Yes, Ganguji. Yes. Last question.
Ma'am, good evening, ma'am.
Yes. Good evening.
Ma'am, I've been using color therapy for this thing, dark blue and sky blue and red. And for here, for the joint pains, I'm putting black. But whenever I'm traveling, I get a lot of swelling on my legs, ma'am, ankle. I'm a rheumatoid arthritis patient. I get swelling on my ankles when I travel.
Ankles. Okay. Then you just have to other elements also. Just set it for Ganguji. Finger number 4, yellow color on the knee joint.
Here,
Yellow color.
right index finger.
Yes, right index finger. Yes.
I should put yellow. 4.
Yellow. Yes.
When I'm putting dark blue 2, I should not put 4. Can I use both?
Dark blue, where are you putting? Where?
Here in the palm. 2.
Okay, why is that?
This is for swelling.
Okay.
Ankle swelling.
No. I don't think you can try that. Just try yellow color, Ganguji.
Okay. Ma'am, I want to thank you. I'm using this symbol and I'm very, very peaceful and happy, ma'am. And thank you very much.
That's amazing. Very nice.
The 3.
Yes, I think you are. Yes. Quickly,
Ma'am,
Ganguji.
319 is for energy. 319.
Overall, energy, everything, healing, and everything. Lot of advantages. Awesome. Thanks, Ganguji, for sharing your valuable feedback. Awesome. So we're done with the session.
One last query. Let me see if they are opening their video, or else we can just skip.
Yes. I think Manaka ji, I'll ask. Manaka ji.
Hi. Hello.
Hello.
Yes, Pooja ji.
Hello.
I have joined in very late. I had some commitment. I wanted to know, I have chronic constipation. Also, I have fungal in the esophagus, and they're saying there's dryness energy, like a Jogren type of syndrome. So, but it's
Okay.
not being diagnosed yet. The rheumatic doctor said that this is your situation, but
Okay.
I refuse to believe, and I know that there is definitely a cure. Now I'm getting chronic constipation because of the dryness, in spite
Okay.
of everything. How do I
Okay.
have constipation?
Okay. So what you have to do is, so dryness is related to Vayu elements. You just have to sedate Vayu. So how do we sedate Vayu? The color, if you all remember, it's light blue color. Light
Yeah.
blue. Finger
Yeah.
number 2, light blue on the large intestine area. Sedate Vayu, because there's too much of Vayu. Wind energy is excess. Okay. So sedate Vayu and then sedate Prithvi as well. Finger number 5, sedation. Sedation color is orange. So this is for chronic constipation. And also I think someone gave fantastic feedback. Orange color on both little finger
Yes.
on the joint, first joint.
Yes.
Yeah, so try this Manakaji. So definitely you'll see the changes. And
So
also
you
put some castor oil on the
So-
belly button area.
Sadly, on my belly button itself, I have an eczema issue. So I
Oh,
was putting castor oil, and it was just triggering more of the eczema. So
oh, then
I
this is
don't know what
chronic.
is wrong, but there is something really bad. So
Oh,
within the gut itself.
gut. Yeah, a lot of
Yeah.
gut health related issues.
Yes.
Yes.
Can I communicate with you directly, and then you can help me out with what has to be done, because
Yeah,
I'm
sure,
new
sure.
to this group. I'm totally new.
Oh, okay. Yeah, sure, sure. Definitely. Definitely. Yes. Yes, yes. You can connect with me directly. Yes. Yeah. So done with the session. Yes, and other class. So we are going to cover the 2 elements.
Just finish off with Sri. Sri, please unmute.
Yes, last question.
Sri, you have to unmute yourself.
I can't hear you.
Okay, I have removed her.
Okay. Okay. Yes. Yeah, done, ma'am. Manusha, ma'am. I hope everyone enjoyed the session. Yes. So, yeah. Yeah.
Thank you so much for this wonderful session, ma'am. Sending
Yeah,
gratitude from
thanks.
all of us to you for this wonderful color therapy session. So
Thank
till
you.
we meet again, thank you so much. Gratitude for this wonderful session and happy weekend to you. And tomorrow again, we have 8 p.m. neurotherapy. Everyone, I request you all to attend. And I request all of you, if any more questions, you please go back to the group and just answer it. Okay. Thank you so much. Good night, everyone. Thank you from all of us to Pooja ma'am. Thank you.
Thank you,
And
ma'am. Thank you, everyone. See you. Bye.